With any successful organization, there is a requirement for successful leadership, and one gentleman here that has done exactly that for many years is a man that I want to hear from this morning, Ken Wilhelm, our Executive Director.
Thank you, Bob. And today marks the beginning of my 28th community fundraising campaign for United Way of Deschutes County. And I believe this is only the second or third time that I've been a featured speaker at a kickoff event, for what it's worth. So what compels me to do so today? Why is today different? Our organization, and I use the term our organization intentionally, our organization has come to a fork in the road. Many of you are familiar with the great philosopher and New York Yankee catcher from the 1950s and 60s, Yogi Berra. And Yogi advised, when you come to a fork in the road, take it. Well, I'm a long-term St. Louis Cardinal fan, and I kind of therefore detest anything that's New York Yankee-ish. But I think Yogi had it right about this. And our United Way has come to a fork in the road. The road behind us is one that we're pretty familiar with. Each year we've brought people together to help other folks improve lives, shape a better community. And we do this primarily through fundraising through the community campaign. And through our programs and those of our 26 partner agencies, we've helped thousands of lives each and every year. We've helped young children get off to a good start in life. We've helped keep them on track for success, helping to people meet some of our basic needs, which has become a bigger issue over the years in our community, and helped keep some of our most vulnerable citizens safe from abuse and violence. This has been a good thing and not to be taken lightly. However, as we look around from where we stand here today, we see a community that continues to be challenged by serious problems of food insecurity, housing affordability, educational achievement, and inequitable access to health care and a prosperous future. All this in a vibrant community with many resources and talented, dedicated, and caring people. With this in mind, our organization has spent the last year and a half wrestling with who we are as an organization and our role in addressing these community problems. And we have come to the conclusion that we can do better, that we have to do better. We have to do more than raise money and fund programs, regardless of how good they are. And by and large, they are excellent. And I'd like to take this opportunity to ask all of our agency, community partners, and representatives that are here today to stand and take a bow, please. We are nothing without the work that they do. But in addition to financially supporting programs that are helping people today, we must address the circumstances that foster and perpetuate these pernicious problems in our community. That is why United Way has committed to transforming to a collective impact model to achieve greater impact in our community and focusing on the three building blocks that Eli talked about: education, health, and financial stability. They are a foundation for everything that matters in life. And improving outcomes in these areas are the most cost-effective ways of improving community outcomes. We all benefit when a child enters school ready to learn, or when a prevention screening catches a cancer before it can spread, or when a family runs out of money before they run out of money. So how will this be different from the work of the past decade? In some ways, it won't look that different at first. Glancing at this year's campaign brochure, you'll see that our longtime partner agencies are already working in these areas. And we expect to continue to work with them to achieve specific community level outcomes. That's one difference, a shift from focusing on program outcomes to include community level outcomes. Another difference is expanded partnerships. We haven't developed the delusions of grandeur that our organization can affect that kind of systemic change all by ourselves. But United Way is uniquely poised to recruit people and organizations that bring the passion, expertise, and resources needed to make long-lasting, visible, and measurable change in our community. But where do we start? I think there's broad recognition that there is great interconnectivity among social problems. It's hard to learn when you're hungry. Poor academic success impairs one's ability to earn a good living. And insufficient income can lead to food insecurity, and so on and so forth. So while it would seem that starting anywhere would work, to create long-term sustained change, there needs to be broad-based agreement about a community agenda and outcome goals. We're still investigating where the greatest opportunities lie for United Way of Deschutes County and our community. After looking at several issues, we've currently narrowed our focus to the issues of adverse childhood experiences, sometimes referred to as ACEs, and food insecurity. And we're seeking to learn more about these two issues and who is doing what in these areas and where the opportunities and pitfalls lie. And along with the expert information we'll be gathering, we will also be conducting community conversations to capture public voice on what matters to people in our community. In the meantime, we have a couple of more immediate efforts that we're working on. We're stepping in as the fiscal sponsor for the social worker in the library program that you may have read about in the paper a couple of months ago. It was a pilot program started by an intern doing her master's. SWIDL, as it's affectionately known, places a professional social worker in the library to create an accessible, no strings attached connection to social service resources such as housing, food stamps, Social Security, and medical services. Our intent is to take that from a successful pilot to a long-term sustainable effort. We're also helping the Family Resource Center to promote VROOM, a multimodal program designed to help children build their brains during the critical first 5 years of life by turning everyday moments such as a mealtime and bath time into brain-building opportunities by providing bite-sized activities that fit easily into a parent's daily routine. We're also planning to offer assistance to the early literacy development program, Read It, Read It. Our exact role is still being worked out. But by now it should be clear to you that we are changing and that where we are going is not exactly clear. But what is clear is that we aspire to do more, to be more, and that we are changing the way we do business. We have come to the fork in the road, and we are taking it. It should prove to be an interesting journey, one which we hope will benefit the whole community, and we can use all the company and help we can get. So I invite you all to come along on this journey with us. Together we can create a healthier and more prosperous community with opportunities for everyone. Thank you.